If you watch the video to the end, you will get information about what causes nausea after eating and how to get rid of it. Thanks for watching. No one wants to feel nauseous, especially after eating a good meal. However, if you feel nauseous within minutes or hours after eating, there may be some underlying problems. What causes nausea after eating? Since there can be many conditions that trigger nausea, it can be difficult to determine the real cause. Common causes include things like stress, food allergies, unwanted side effects of medications, taking too many supplements or vitamins, or pregnancy, diseases of the gallbladder, liver or pancreas, or diabetes and thyroid disorders can also make you feel sick after eating. Read below 12 reasons that cause nausea after eating. Viral or bacterial infection. Have you ever heard of a stomach cold? If you have a viral or bacterial infection, your whole body is affected. In this case, you may feel nauseous immediately after a meal and may continue to feel nauseous for 24 to 48 hours. However, symptoms such as fever, muscle pain, and joint pain are also usually present in case of a stomach cold. A stomach cold is a condition that affects the whole body. It comes on suddenly and usually goes away on its own. Food poisoning. You may have a physical reaction to spoiled food. You can get food poisoning if you leave things like meat and dairy products out for too long or if the person who prepared the food has dirty hands. Sudden onset of food poisoning can cause nausea, but it usually goes away on its own. With food poisoning, vomiting and diarrhea are not necessarily bad things. They are ways for the body to get rid of infections, toxins, and other things before they are absorbed. Food allergies. Food allergies affect everyone in different ways. The first time you experience a food allergy, your symptoms may be mild. However, after that, you will start to react faster and more intensely each time you encounter that food. With food allergies, you may experience symptoms such as urticaria, feeling cold, a drop in blood pressure, increased heart rate, swelling of one of the eyes, and swelling of the throat in addition to nausea. Stress and anxiety. Even if your stress and anxiety have been going on for a while, your body may react physically to them. The reason why you experience physical symptoms such as nausea is because your brain activates the fight or flight response. With this reaction, your body starts to release various hormones. Everyone's stress and anxiety threshold is different. For example, let's say two people are watching a movie. One of them likes horror movies while the other is scared. The stress hormones secreted by these two people will be different. One will experience increased heart rate and other physical changes, while the other will enjoy the movie. Reflux. You may experience heartburn, especially shortly after eating spicy, fatty, and heavy meals. This burning sensation can also move up into your chest and throat, causing nausea. Reflux occurs when too much stomach acid escapes into the throat and stays there. Most of the time this is normal. But gastroesophageal reflux disease can damage the esophagus and lead to chronic irritation, inflammation, ulcers, and more. Irritable bowel syndrome. Sometimes the bowels do not move as they should. If you have irritable bowel syndrome, you may have problems with the movement of stool through the intestines. Even if your intestines are structurally normal, stool can move too slowly or too quickly through the intestines. Irritable bowel syndrome can cause the stool to stay in the intestine and not move down, which can cause nausea to get worse. To find out if you have irritable bowel syndrome, you need to know where the pain is coming from. If the pain reaches your chest or throat, you may have reflux. But if it hits your belly button, the problem may be in your intestines. Overeating. You may experience nausea when your stomach is too full and you keep eating, while the food is still in your stomach. Overeating can happen when you are bored while eating. You may eat snacks out of habit instead of eating when you are hungry, or you may snack when you are busy or bored. To avoid overeating, you can set yourself a routine and try to eat regularly whenever possible. You can also practice portion control by taking your food on a plate instead of eating directly from the pot. Medicines. Some medicines, such as neurological medicines, anti-seizure medicines, and mood-altering medicines, can affect appetite and cause nausea. Other medications that cause nausea may include opioid-based narcotics and other pain medications. Diabetes. Too high or too low blood sugar can also cause nausea. However, if you have had diabetes for a long time and it is under control, you may experience diabetes-related gastroparesis. In this case, your stomach will not work as it should and food will digest more slowly. Gallbladder disease. You can thank your gallbladder for being able to eat all those fatty foods you love. The bile created by your liver is stored in your gallbladder. Your gallbladder then releases this bile to break down fatty foods. When you have gallbladder disease, this important process can be disrupted and cause nausea and other symptoms. With gallbladder disease, you may feel nauseous 15 to 20 minutes after eating. Nausea may be accompanied by abdominal pain, diarrhea, changes in stool color, and sometimes unexplained weight loss. Pancreatitis. Pancreatitis can occur due to gallstones, alcohol abuse, autoimmune disorders, and other causes. When you eat something, your pancreas starts producing enzymes to break down food. But if your pancreas is inflamed or damaged, it may not produce enough enzymes. Pancreatic disorders can cause abdominal pain, nausea, diarrhea, and unexplained weight loss. Chronic mesenteric ischemia. Mesenteric ischemia occurs when the blood supply to the digestive organs is impaired. This can be caused by plaque buildup in the arteries or hardening of the arteries, as well as prolonged low blood pressure, arterial inflammation, and other things. In general, people who smoke, have high cholesterol, or vascular diseases such as coronary artery disease or peripheral vascular disease are at higher risk. How to relieve nausea after a meal. Things like eating saltine crackers, eating small amounts of ginger, and resting can help with nausea. However, you should not do too much to treat yourself. However, there are some small things you can do to make yourself feel better. It is not normal if your nausea recurs and does not get better on its own. Recurring nausea that does not go away may be due to underlying causes. Therefore, if your nausea does not go away, you should see a doctor.